The complexion of a normal person should be shiny and moist with a mixture of yellow and red. The color of a normal complexion can also be seen in terms of host color and guest color. Host color refers to the base color that varies with individuals, while guest color refers to the color of the face that varies with the climate and other environmental or physical conditions. A normal complexion indicates normal conditions of the five viscera. Likewise, when a person has a very good complexion, it means that the energy conditions of the five viscera are excellent. The complexion of a person can also be evaluated in terms of good outlook or bad outlook. A moist and bright complexion indicates a good outlook, whereas a withering and dry complexion indicates a bad outlook. As fingerprints are more visible in children than adults, a diagnosis by fingerprint can be used with children under 3 years old. Diagnosis by fingerprint focuses on the color and density of the print. In making a diagnosis, a physician should use the thumb and forefinger of his or her left hand to hold the tip of the patient's forefinger, while using the thumb of his or her right hand to lightly push the patient's forefinger from the tip towards the base. This way, the print will become more visible. The physician should observe the print very carefully. A normal fingerprint will appear reddish yellow with a degree of brightness. When the print appears to be floating, it normally points to a superficial disease. When it appears deep, it normally points to a deep disease. A light color of a fingerprint generally points to a deficiency or a cold disease. A purple-red color to a hot disease. A blue-purple color to convulsions, wind cold, pain, indigestion, and wind sputum, and a black color to blood coagulations. Observation of the tongue, commonly called tongue diagnosis, is an important aspect of diagnosis by observations. It primarily focuses on the coating of the tongue and the quality of the tongue with reference to shape, colors, movement, and degree of moisture. There is a Chinese saying that goes like this: differentiation of the quality of the tongue enables us to differentiate the five viscera regarding excess and deficiency. Observations of the tongue coating enable us to determine how deep the 6 external pathogenic energies have penetrated into the human body. The quality of the tongue is also called the body of the tongue. In evaluating the tongue, it is generally believed that the tip of the tongue is symptomatic of the heart and lungs. The sides of the tongue are symptomatic of the liver and gallbladder, and the root of the tongue is symptomatic of the kidneys. But these are only broad associations that should be applied with flexibility. A moist tongue often indicates the presence of sufficient body fluids. A withered tongue often indicates an exhaustion of body fluids. An old tongue often indicates an excess disease. A tender tongue often indicates a deficiency disease. When the body of the tongue appears light, red, fat, and tender, it may point to a yang deficiency. When the body of the tongue appears thin and bright red, it often indicates a yin deficiency. When the tongue is as shiny as a mirror with a coating, it points to yin deficiency of the liver and kidneys. When the tongue is swollen and painful, it points to excessive fire in the liver. In terms of the tongue coating, a normal coating is white, but the tongue will only have a thin layer of white and clear coating, which is produced by stomach energy. A pathological white coating of the tongue is primarily due to wind, cold, and dampness, and it indicates a superficial disease. If the coating appears thin and glossy, it is mostly due to internal cold and dampness or external wind and cold. If the white layer of coating appears dry, it is due to a shortage of fluids. If the white coating occurs in a disease due to an attack of external pathogenic energies, then it generally indicates that these energies are beginning to transform into heat that may cause harm to fluids. A thick layer of white and glossy coating generally points to an excess of internal dampness. If the patient is also suffering from a superficial disease at the same time, it is due to external cold producing internal dampness. A thick layer of white and dry coating is due to heat harming fluids, with an inability of dampness to undergo transformation. A tongue with a white, glossy, sticky, greasy coating is mostly the result of internal sputum and dampness. A yellow coating of the tongue indicates a hot disease. namely the presence of the hot pathogenic energy in the internal region. A thin layer of yellow and glossy coating points to a dampness heat disease, and in a disease of external pathogenic energy, this coating points to the external pathogen transforming into heat in the internal region with fluids remaining unharmed. A thin layer of yellow and dry coating points to the hot pathogen harming yin fluids. A thick layer of yellow and glossy coating points to dampness heat in the stomach and intestine. A thick layer of yellow and dry coating points to an accumulation of heat harming fluids. And a yellow and greasy coating of the tongue indicates dampness heat in the spleen and stomach, dampness sputum, or indigestion. Diagnosis by questioning the patient. This consists of questioning the patient regarding pain, time of onset, history, habits, and so on. Chinese physicians from the past developed 10 essential questions for this purpose concerning 1. Cold and hot sensations, 2. Perspiration, 3. Head and body, 4. Urination and bowel movements, 5. Eating, 6. Chest, 7. Hearing, 8. Thirst, 9. Pulse and color, and 10. The spirits. Subsequently, the 9th and 10th questions have been changed. The 9th question now concerns old diseases, and the 10th question the causes of diseases. Diagnosis by hearing and smell. This includes hearing the patient's voice and the sounds of coughing, respiration, and so on, and smelling the patient's mouth and body. Some diseases may give rise to offensive smells, such as ulcers, tumors, or carbuncles. In some acute contagious diseases or in failure of the liver and kidney functions, there may be special smells to be detected. In addition, when a patient is suffering from heat in the lungs and stomach, he or she may have bad breath. This may also be the case when a patient is suffering from indigestion. Pulse diagnosis. Pulse diagnosis involves the use of 3 fingers to press the radial artery of the wrist, with the throbbing segment of the radial artery divided into 3 sections, namely the distal section, middle section, and proximal section. To take the pulses to determine the pulse rate, force, wave, and so on. Numerous pulses were discovered in ancient China, and about 28 pulses are in frequent use in clinical practice today. The pulse can tell us about the nature of diseases. For instance, a superficial pulse is symptomatic of a superficial disease. A rapid pulse is symptomatic of a hot disease, and a slippery or a sliding pulse is symptomatic of a sputum disease, indigestion, excess heat disease, or pregnancy. A normal pulse is also called a constant pulse, which is indicative of stomach energy, and it appears harmonious, slow, but forceful, neither too fast nor too slow, and at about 4 beats per active respiration or 70 to 75 beats per minute. Children may display a faster pulse. Pulse rate may also be influenced by physical activities, climate, and other environmental conditions. Abnormal pulse refers to any pulse other than a normal one. For example, a big pulse is an abnormal pulse, unless it is taken when a person is engaged in energetic activities. The 28 pulses most frequently used in diagnosis include the following: depth-related pulses, 1. Superficial pulse, and 2. Deep pulse. Frequency-related pulses, number 3. Slow pulse, and number 4. Rapid pulse. Strength-related pulses, number 5. Deficiency pulse, number 6. Excess pulse, number 7. Big pulse, and number 8. Small pulse. Length-related pulses, number 9. Long pulse, and number 10. Short pulse. Movement-related pulses, number 11. Slippery pulse, number 12. Retarded pulse, and number 13. Wiry pulse. Change-related pulses, number 14. Abrupt pulse, number 15. Clotting pulse, and number 16. Intermittent pulse. And combination pulses, number 17. Relaxed pulse, number 18. Full pulse, number 19. Disappearing pulse, number 20. Tight pulse, number 21. Soft pulse, number 22. Weak pulse, number 23. Drumming pulse, Number 24, persisting pulse. Number 25, shaking pulse. Number 26, hidden pulse. Number 27, dispersing pulse. And number 28, empty pulse. The 8 syndrome classifications. The 8 syndrome classifications are Yang syndrome, Yin syndrome, superficial syndrome, deep syndrome, cold syndrome, hot syndrome, deficiency syndrome, and excess syndrome. Yin and Yang are opposed to each other and indicate the different types of disease. Superficial and deep are opposed to each other and indicate the regions of a disease. Cold and hot are opposed to each other and indicate the nature of a disease. And deficiency and excess are opposed to each other and indicate the conditions of a disease. The superficial, hot, and excess syndromes are all Yang syndromes. The deep, cold, and deficiency syndromes are all Yin syndromes. Yang syndrome, a disease that is acute, active, forceful, and progressive, belongs to the Yang syndrome, with such symptoms as red complexion, fever, love of cold, nervousness, dry and cracked lips, love of drinking, loud voice, love of talking, rough breath, and constipation. When a symptom belongs to the Yang syndrome, the pulse is normally superficial, big, rapid, slippery, excessive, and forceful, and the tongue is normally red in color with a yellowish and dry coating or even prickles. Yin syndrome, a disease that is chronic, weak, quiet, and inhibitive, belongs to the Yin syndrome, with such symptoms as pale complexion, fatigue, heavy sensations in the body, cold limbs, low voice, quiet with dislike of talking, feeble breath, shortness of breath, decreased appetite, love of heat, long and clear streams of urine, and abdominal pain with desire for massage. In the Yin syndrome, the pulse is normally deep, fine, slow, and weak, and the tongue is normally light in color and fat and tender, with a moist or sliding coating. Superficial syndrome, a disease that occurs in the skin and hair or in the external regions of the meridians, belongs to the superficial syndrome. Deep syndrome, a disease that occurs in the internal organs, belongs to the deep syndrome. For instance, a warm or a hot disease due to external causes with the pathogenic energy residing at the superficial region of the body belongs to the superficial syndrome. But when the pathogenic energy enters into the deep region to affect the energy in blood or the internal organs, it belongs to the deep syndrome. Cold syndrome. This syndrome includes all diseases caused by cold pathogenic energy or by a decline in Yang energy with Yin excess. The symptoms may include low body temperature, pale complexions, withered spirits, fatigue, sleeping with legs curled up, love of warmth, fear of cold, cold abdominal pain that lessens with warmth, absence of thirst or thirst with a craving for hot drink, discharge of watery stools, clear and long streams of urine, pale tongue with a white and sliding coating, and deep and slow pulse, which are mostly seen in chronic and weak diseases. Hot syndrome. This syndrome includes all diseases caused by hot pathogenic energy or an excess of Yang energy. The symptoms may include fever, depressed feeling, red complexion, dislike of heat, dry lips and mouth, love of cold drink, red and dry lips, constipation, short streams of reddish urine, red tongue with a yellowish and dry or black and dry coating, and rapid pulse, which are usually seen in contagious and excess diseases. Deficiency syndrome. This syndrome encompasses all diseases caused by a decline in body energy. The symptoms of this syndrome include pale complexion, low spirits, fatigue, weakness, palpitation, shortness of breath, excessive perspiration, night sweats, tender tongue with no coating, and deficient and weak pulse. Excess syndrome. This syndrome encompasses all diseases caused by an excess of pathogenic energy, engaged in a violent struggle with body energy or occurrence of energy congestion and blood coagulations due to an internal functional breakdown that may also lead to sputum and indigestion. The symptoms of the excess syndrome may include high fever, thirst, mental depression, delirium, abdominal fullness, and pain that worsen with massage. Constipation, short streams of reddish urine, old tongue with a yellowish, dry, and rough coating, and excess and forceful pulse, which are mostly seen in acute diseases. The 8-gram methods of treatment. There are 8 grand methods of treatment in Chinese medicine that have been established as the guiding principles in clinical practice. There are the methods of inducing perspiration, clearing heat, inducing bowel movements, striking a balance, or the harmonizing method, warming up coldness, tonification, eliminating and inducing vomiting. The method of inducing perspiration. Inducing perspiration is also called initiating the superficial region in Chinese medicine. The objective of inducing perspiration is to induce the external pathogenic energies that have penetrated the human body to move outward by means of perspiration. In Chinese medicine, it is maintained that a pathogen will attack the human body from the outside and then it will penetrate into the body step by step. For this reason, when the pathogen is still residing in the superficial region, namely the regions of the skin, hair, and muscles, it is necessary to induce perspiration. This way, the pathogen will have a chance to get out of the body before it penetrates further into the body to cause a deep syndrome. The superficial syndrome, including such symptoms as dislike of cold, fever, headache, pain in the body, and superficial pulse, should be treated by inducing perspiration. As each patient is different in terms of physical conditions and as each disease is also different, the superficial syndrome is further divided into the superficial cold syndrome and the superficial hot syndrome. However, the two syndromes are, in most cases, closely related to each other, and in clinical practice, they are usually treated together. Perspiration can be induced with pungent and warm herbs or with pungent and cold herbs. In Chinese herbal therapy, herbs or foods with a pungent flavor and warm energy are used to treat a superficial cold syndrome, which displays the following symptoms: dislike of cold, fever, no perspiration, headache, nasal congestion, pain in the four limbs, thin and white coating of the tongue, and superficial and tight pulse or superficial and relaxed pulse. In Chinese herbal therapy, herbs or foods with a pungent flavor and cold energy are used to treat the superficial hot syndrome, which displays these symptoms: fever, headache, slight dislike of cold and when presence of perspiration, thirst, sore throat, red tongue with a thin yellow and dry coating, and superficial and rapid pulse. The method of clearing heat. To clear heat means to be clear and sedate the pathogenic heat for various kinds of deep and hot symptoms. Clearing heat can also be used to treat deficiency heat or superficial heat. However, in clinical practice, a distinction must be made among the different types of heat, including energy heat, blood heat, yin heat, toxic heat, dampness heat, heat in the internal organs, excess heat, and deficiency heat. For instance, energy heat and excess heat should be treated by clearing heat and sedating fire at the same time. Blood heat should be treated by clearing heat and cooling blood at the same time. Yin heat should be treated by clearing the heat and nourishing the yin at the same time. Toxic heat and excess should be treated by clearing heat and counteracting toxic effects at the same time, and heat in the internal organs should be treated by treating the organs involved. To clear heat and sedate fire. Basically, this means treating energy heat, which normally displays the following symptoms: high fever, thirst, dry tongue, yellowish and dry coating of the tongue, and forceful and rapid pulse. To clear heat and cool blood. This involves treating blood heat, which normally displays the following symptoms: high fever, mental confusion, delirium, deep red tongue, and bleeding. To clear heat and counteract toxic effects. This involves treating various types of toxic heat, which usually displays the following symptoms: red swelling, fever, pain, pustulation, and decomposition. Toxic heat includes the diseases caused by an attack of external energies, with such symptoms as sore throat, ulcers, vomiting of blood, nosebleed, and delirium, all of which belong to the hot syndrome. To clear heat in the internal organs. This involves treating heat in the internal organs that display various symptoms. For instance, excess heat in the heart meridian will give rise to feeling depressed, thirst, ulcers in the mouth and on the tongue, short streams of reddish urine, difficulty in urination, and pain on urination. Excess fire in the liver meridian will give rise to pain in the upper abdomen. bitter taste in the mouth, pink eyes and pain in the eyes, wax in the ears, urinary straining, ulcers in the genitals, and red swelling of the scrotum. Heat in the lungs will give rise to cough and asthma. Hot stomach or heat in the stomach will cause bad breath and swelling and bleeding of the gums, all of which may be treated by this method. To clear heat and transform dampness. This involves treating dampness heat, which generally displays the following symptoms: intermittent or prolonged fever, congested chest, abdominal swelling, sticky sensations in the mouth, nausea, poor appetite, reddish urine, watery stools, and yellowish and greasy coating of the tongue. The same method can also be used to treat a syndrome called dampness heat turning into fire, which generally gives rise to dysentery, jaundice, hot urinary straining, or discharge of yellowish fluids and skin diseases. To clear heat and lubricate dryness. This involves treating three syndromes. Number 1, the lungs dryness syndrome, in which dryness impairs the lungs and the stomach, causing dry throat, thirst, and dry cough with scant sputum. Number 2, the Ha syndrome, particularly at its later stage when both energy and yin are impaired, causing such symptoms as dry mouth, mental depression, hiccups, and poor appetite. And number 3, the deficiency heat syndrome, which gives rise to such symptoms as hot sensations in the body as if they were coming from the bones, periodic fever, night sweats, or persistent low fever. The method of inducing bowel movements. Inducing bowel movements relieves constipation, and for this reason it can be used to treat a variety of syndromes as long as they involve constipation. To sedate excess heat. This method involves treating the following three syndromes. Number 1, the stomach heat syndrome, with such symptoms as periodic fever, delirium, abdominal fullness, abdominal pain worsening with massage, constipation, scorching and yellowish coating of the tongue with prickles or scorching, black, dry coating on a cleft tongue, and slow and sliding pulse. Number 2, the toxic heat syndrome, with such syndromes as high fever, feeling depressed and hurried, mental confusion, twitching, dry mouth and throat, constipation, bleeding, and skin eruptions. And number 3, heat in the internal organs, which gives rise to sore and swollen throat, ulcers in the mouth and on the tongue, swollen gums, nosebleed, bad breath, constipation, hot sensations in the chest and diaphragm regions, headache, pink eyes, ringing in the ears, feeling hurried and jumpy, and yellowish coating of the tongue. To attack cold accumulations. This method is used in treating the internal coldness syndrome, when a person consumes too much cold food with cold energy accumulating in the stomach and intestine. Acute pain in the stomach and abdomen may occur that gets worse with massage, or when a person suffers from deficiency cold of the spleen and stomach. Normal transformations in digestion are impaired, with the result that cold energy gets accumulated in the stomach and intestine, which may give rise to the following symptoms: abdominal pain that lessens with warmth, hardness felt with massage, thirst with craving for hot drink, constipation or difficult bowel movements, fear of the cold, cold limbs, and white and sliding coating of the tongue. To lubricate the intestine to induce bowel movements. This is used in treating the intestine dryness syndrome for relief of constipation in older or weak patients, or in pregnant women due to blood deficiency and shortage of fluids. The method of striking a balance or harmonizing. This method of treatment can also be called negotiating a settlement, because it is aimed at regulating and adjusting the relationships among the internal organs, meridians, energy, and blood, for the purpose of removing external pathogenic energies to restore the normal functions of the body. This principle of treatment can be used in three different ways. To harmonize the superficial and deep regions, this involves treating the syndrome in between the superficial and deep, which normally displays the following symptoms: alternating cold and fever due to external causes, congested chest and discomfort in the upper abdomen region, being quiet with no appetite, feeling depressed, nausea, bitter taste in the mouth, dry throat, dizziness, and wiry and rapid pulse. To regulate and harmonize the stomach and the intestine. This involves treating the cold and deficient large intestine syndrome when external pathogenic energies reside in the stomach and intestine. Women display such symptoms as combination of chills and fever, dull sensations at the pit of the stomach, nausea, abdominal pain, watery stools or diarrhea, and intestinal rumbling, which can be treated by this method to regulate and harmonize the liver and spleen or stomach. This is used in treating two syndromes: the liver-spleen disharmony syndrome and the liver-stomach disharmony syndrome. The liver-spleen disharmony syndrome involves two distinct syndromes: the liver energy congestion syndrome and the spleen deficiency syndrome. The two syndromes are very similar and may include the following symptoms: feeling depressed, abdominal swelling and pain, discomfort in the chest, intestinal rumbling, and diarrhea or tension causing abdominal pain and diarrhea. The liver-stomach disharmony syndrome also involves two distinct syndromes: the liver energy congestion syndrome and the stomach energy upsurging syndrome. Likewise, both are very similar and may include such symptoms as congested chest, poor appetite, vomiting, belching, acid regurgitation, and pain at the pit of the stomach. The method of warming up coldness. Warming up coldness is also called expelling coldness, and it is designed to tone up yang energy in order to expel the cold pathogen from the body. This method is used to treat the internal coldness syndrome, which is also called the deep coldness syndrome, as opposed to the superficial coldness syndrome. In Chinese herbal therapy, herbs to be used for warming up coldness are either warm or hot. The internal coldness syndrome is mostly due to a yang deficiency that has existed in one's physical conditions and generated coldness within the body, or due to an attack of an external cold pathogen, resulting in a cold stroke involving internal organs that give rise to a yang deficiency of the organs affected. Meridian coldness is mostly due to an accumulation of cold energy in the meridians, causing a blockage of energy and blood within the meridians. There are a number of different methods of warming up coldness.